Good morning, ladies and gentlemen. My name is Ezinne Victoria Onwuekwe, a pharmacist and vaccine program coordinator at Africa Centers for Disease Control and Prevention, Africa CDC. It's a pity I could not be there with you in person as I had to be away on an official mission, but I would like to share a few words with you. Post West Africa Ebola outbreak of 2014 and 2015, the African Union heads of states came together in January 2016 and unanimously agreed that there is a need to establish a specialized technical institution to see to the preparedness and response to similar outbreaks. And that was how Africa CDC was bettered and launched in January 2017. Africa CDC is now an agency of the African Union, who were recently granted full autonomy at the just concluded Heads of State Summit in Zambia, and we established to support public health initiatives of member states and strengthen the capacity of their public health institutions to detect, prevent, control, and respond quickly and effectively to disease threats. How do we do this? Through strengthening capability, and partnerships of Africa's public health institutions to respond to these threats based on science, policy, data-driven interventions, and programs. We have a lot of networks. We build networks between countries, between organizations, between institutions, and a lot of other programs that are related to outbreak response. Of course, we do not work alone. We work with several partners, including African Union entities, regional economic communities, international bodies, regional health organizations, NGOs, non-for-profit organizations, UN agencies, as well as bilateral and intergovernmental organizations. Africa CDC operates through its 5 regional collaborating centers. There's one in Zambia for the south, Kenya for the east, Gabon for the central, Nigeria for west, and Egypt for northern Africa. These in turn work with the ministries of health and national public health institutes of their countries in the regions. But enough about Africa CDC. Leveraging on this year's IPSF's theme, pharmaceutical evolution in the era of technological advancement, the present and its future, I feel it is time for pharmacists to step up and show up in the various sectors of health and outbreak response and areas that we haven't been very active in. I will speak about outbreak preparedness and response in Africa. In Africa CDC, we talk about the new public health order, which focuses on 4 key elements: local production of therapeutics, vaccines and diagnostics, trusted partnerships, a strong public health workforce, strengthen public health institutions. Do you see where pharmacists play a role? Definitely. As you deliberate this week, think outside the box, outside the traditional pharmaceutical careers. Think diagnostics, drug manufacturing, antimicrobial resistance, supply chain management, which is limitless, demand and supply planning, supply chain operational analytics, quantification, forecasting, and the likes. Think healthcare data analytics, pharmacovigilance, pharmacoeconomics. The possibilities to be involved in outbreak preparedness and response are endless. To wrap up, I would like to touch on an initiative of Africa CDC that involves young people called the AU COVID-19 Vaccination Bingo Initiative, where we leverage on the young demographic we have in Africa to using the youths as champions to drive vaccination campaigns to boost the COVID-19 coverage in Africa. I encourage you to look out for more information on our website and that of the Youth Division of the African Union so that you can see how you can get involved. We also are going to look for ways to partner with IPSF on these in the coming months. Finally, as a fellow pharmacist, I would advise that you get mentors or career coaches. It's never too early. I am a product of mentorship, and I'll propose to your leadership that they organize sessions on how you can seek out mentorships and career coaches. I would wish you well in your deliberations, and I look forward to more collaborations with IPSF. Thank you very much.